our culture has made it a lot more popular and acceptable to augment your body. People are documenting their journeys on YouTube and TikTok, letting people know. So it's definitely a much more open conversation that we're having these days about the BBL.
Cosmetic surgeries are being popularized on social media platforms daily. The Brazilian Buttlift, commonly referred to as a BBL, is the latest trend jumping off of our timelines and into our daily lives. On the video sharing platform TikTok alone, the BBL hashtag has garnered nearly 3 billion views and continues to climb daily, from influencers documenting their procedures, calling out surgeries performed by their favorite celebrities, and even doctors themselves jumping in and sharing information. The BBL both celebrates and commodifies a standard of beauty created by Black women, despite this fact not being emphasized in mainstream media. But big butts and round hips have captivated American culture for decades. The trend is far from over, and for some, it may be concerning. Social media continues to skew our perception of reality, so today, we're sitting down with a certified cosmetic surgeon to get the truth on BBLs.
My name is Dr. Martha Ayewah. I'm a cosmetic surgeon at Lexington Plastic Surgeons in New York City. I decided to be a cosmetic surgeon because I knew that I wanted to take care of people, how they look, how they feel, and really just make them feel like their best selves.
What is a BBL and why is it so popular?
So a Brazilian butt lift is a surgery where you take fat from one area and you put it in the bottom to give an augmentation to the butt. Calling it a lift is actually a misnomer. We're not cutting skin or lifting the butt, but by adding fat to the butt, you actually plump it up and round it out so it looks lifted and more full. The surgery was invented by Dr. Ayewah in Brazil in 1960, where he started putting fat in the butt and inviting other surgeons to learn how to do his techniques. Since then, it has been modified and perfected and made safer over time. Many times patients come in the office and show me a photo from Instagram of a model or a celebrity. Really common ones would be Kim Kardashian and Kylie Jenner, Nicki Minaj, Cardi B. These are people who have really used their bodies in their industry and really attracted a lot of the patients to want to look like that. Oftentimes, if I do see a picture that I don't think matches the patient's body, I do have to make sure that they have realistic expectations before they go into the procedure.
Tell us the truth. Who gets BBL?
There is Caucasians and Hispanic people, people in the Middle East and Asian people getting the surgery. But it is somehow popular that Black women are also getting the surgery a lot. The Black female body is expected by cultural standards to be curvy. There is definitely a pressure in the African American society to have assets, to have a butt, to have boobs that look a certain way. And that's why there might be more pressure to go ahead and get that BBL. It is a common misconception that only women can get BBLs, but that's not true. It's actually open to men as well. The primary reason why men go after BBLs is they want a firmer, more athletic looking bottom. The male bottom looks different than the female bottom in that it's mostly square in shape, whereas a woman is focusing on putting fat on the hips to create a rounded appearance. So it is a slightly different surgery when you're doing a BBL on a man versus a woman. In these underwear commercials, there are guys standing there that have a nice tight look, these athletic people like Cristiano Ronaldo, David Beckham, and people want that look.
What is the process of a BBL?
A typical BBL surgery takes about 2 to 3 hours. This includes the liposuction of the front and the back, and then transferring the fat. We like to put our clients to sleep under general anesthesia, especially where I work at Lexington Plastic Surgeons. It's more comfortable for the patient. They're able to relax completely, whereas sometimes when you do the surgery while they're awake, the patient might feel discomfort and move around. Everybody who gets a BBL typically goes home the same day. Today, a lot of people are attracted to the idea of going out of the country to get surgery. One of the common locations people go to is the Dominican Republic, Colombia, Mexico. The main risk of going out of the country to do surgery is that you may not be in control of your post-op care, especially if you're flying back to the United States too soon after surgery. On an airplane, you are sitting immobile. It puts you at the risk of developing a blood clot. This blood clot can travel to your lungs, and this can be fatal. So I often advise patients to at least have some kind of plan to be staying in one location for 1 to 2 weeks after surgery before they fly back to wherever they came from. Another thing that's important is that if you are getting surgery out of the country, you may not have post-op care here in the United States. Many people end up in the emergency room, and these people are not necessarily equipped to do post-op surgical care. And if your procedure, heaven forbid, is completely botched or you have something wrong with your incision, and you try to go to a surgeon here in the United States who does aesthetic surgery, they may or may not be able to help you based on what the condition of your incision is. So these are some things to consider if you are getting surgery outside of the country.
What advice would you give someone who's looking to get a BBL?
There are some important things to look at and ask your surgeon at your consultation. First of all, you should be asking them, have you been trained to do this procedure? Have you done a fellowship or some kind of training beyond your surgical training to know that you knew how to do cosmetic surgery, aesthetic surgery, and this particular procedure? The next thing you can ask them is, how many times have you done this? How often do you do it? What are your outcomes during your surgery? Have you had any negative outcomes for your surgery? A really important question to ask your surgeon is, how will you keep me safe during this surgery? So you do want to make sure that your surgeon is committed to keeping you safe during the procedure. I don't know how long this trend will last. Our society is evolving, and it might come to the point where people don't really want to look augmented. They might trend towards looking as natural as possible. I don't really know how to predict that, but for now, everybody's trying to look curvy, so we cater to what you want.